Welcome to the Distinctive Dermatologist, the podcast for professionals in dermatology. Our goal is to help your practice stand out and deliver the ultimate experience for your patients, so they schedule repeat visits and refer your practice to their friends. We're here to help your practice become more profitable. Here's your host, 7-time best-selling author, in-residence faculty member at High Point University, Hall of Fame professional speaker, and member of the Sales and Marketing Hall of Fame, Scott McCain.
Welcome again to the Distinctive Dermatologist, where we discuss the issues of dermatology and advance the ultimate customer experience to ensure your practice earns repeat and referral business from your patients. I'm your host, Scott McCain. And as always, the Distinctive Dermatologist is brought to you by GentleCure from Skincare Oncology. GentleCure, tough on cancer, easy on skin. On today's episode, we're going to take a special look at IG-SRT, image-guided superficial radiation therapy. As you know, the leading provider to this alternative to patients is our sponsor, GentleCure from Skincare Oncology. But one aspect that we've never covered in our 4 years of podcasts is how the company came into existence. And there's no better person to ask than its CEO, Kerwin Brent. Here he tells us the genesis of GentleCure.
Yeah, I think at its core it was divine intervention that brought us to be. Just again very rapidly. I was actively engaged with the predecessor company, Excelitech, a limited liability company, and was approached by Stephen Scott to visit him in Texas and to check out what he was doing at a dermatology practice down in Texas and what he had aspirations of really rolling out nationwide. And so I went and visited him, and Stephen really rolled out his view of what skincare oncology, yet unnamed at that point in time, could be, with just the incredible cure rates that they were seeing down in Texas, and the opportunity to roll out nationwide a model that was patient focused for the treatment of non-melanoma skin cancer, that would have superior cure rates to really any other non-melanoma skin cancer treatment, and would have incredible patient satisfaction, and incredible cosmesis as well. And so when Stephen invited me down to Texas, and I went down and I listened to his presentation and what his vision was that we could pull together for skincare oncology, I was really excited about it. In a very short period of time, we raised some initial funding and wrote the business plan and moved through all of the initial processes. And by October of 2016, we had a company formed and had begun to treat patients down in Texas under the GentleCure model, which has proven to be exceptional, really in all regards, beyond really what we probably contemplated back in the day. I think we thought maybe we'd be able to get to maybe 59 or 60 units within 5 years, and we did that in about 21 months, I think. And it's really been a great story. But when I was listening to Stephen down in Texas in early January of 2016, and he said, there's about 15,000 derms in the market, dermatologists in the marketplace. There's probably approaching 6 million non-melanoma skin cancers that are diagnosed annually. Patients are tired of being cut on, and they're looking for an option. And by the way, this option is incredibly curative. Back at that stage, he didn't know exactly how good it was, but he said, the SRT studies are great results, but we can do even better with the quality controls that we're going to put into place. And we can, forge a relationship to have, exclusivity with the only provider of image-guided IG-SRT technology in the world. And we can make this a really unique and successful business model. About the time he mentioned those components, I realized we were onto something. I didn't let him know that right away, but I think I had him wrapped up in a non-compete with me on the transaction within about 2 days. And we approached Dr. Ladd as well, and had him as a part of the ongoing relationship relatively quickly in that process. So I think we realized very early on that this was going to really work. It was going to be a win. I had to present it to my investors at Excelitech. And my peers, all about my age, they didn't think it was such a great idea initially, but thankfully I had a board member who was with us who had had about 8 Mohs surgeries before. And he said, listen, guys, he asked how many of us had ever had Mohs surgery before. And clearly none of us had. And he said, well, let me tell you, as somebody who's had 8 Mohs surgery, if there's an option that's anywhere close to the efficacy of Mohs surgery, and you offer it and it's a non-surgical solution, it'll be a shining success. And, again, a little point of divine intervention, the fact that he was there, and we were able to get the company launched, and the rest is really history. It's really gone consistently up and to the right. Just more and more patients that have been treated. Today is incredibly fulfilling being here with a 100,000 patient. Really great story of a patient who was treated in Chicagoland and relocated into the Scottsdale area. And the first thing that she did was she looked up a dermatologist that also offered GentleCure, and that was a prerequisite for her in selecting a dermatologist because she had been treated before. And as she expected, she had another lesion that maybe even a couple of lesions that appeared, and she went again and once again had another round of GentleCure to cure these additional lesions that were in totally different areas of her face. And she, just to listen to the gratitude from a patient who is so thankful that she, doesn't today bear scars from the treatment of her non-melanoma skin cancer is incredibly gratifying.
Well, now that we've heard about how the company came to be, it's the perfect time to look at a message from our sponsor.
I started playing golf when I was 10 years old, so I've been in the sun my whole life.
Last year, we noticed a spot on Brian's lip. We were very concerned, and we went to a dermatologist.
When I found out it was skin cancer, I was in the middle of a tournament. The dermatologist was recommending surgery, so I was going to miss time on the tour.
I saw a commercial for a treatment called GentleCure. It didn't require surgery and meant no time away from golf.
If you, like millions of others, are affected by skin cancer, it's important to know that surgery isn't the only option. There's another choice, GentleCure. GentleCure uses low-energy X-rays to kill cancer cells with a 99% cure rate. There's no cutting, no surgical scarring, and no downtime.
Thanks to GentleCure, my cancer is gone, and I didn't miss any time on the course.
We've been fortunate. We wanted to use our platform to get this message out. There are options, and patients deserve to know.
To learn more, call today or go to GentleCure.com.
The guiding theme of Skincare Oncology as an organization is first and always about the patient. To get a clinical view of this, we talked with Utah-based dermatologist Dr. Douglas Forshea about how GentleCure is integrated into his highly successful practice.
Mohs has been around since, I think, 1937. Very legitimate, very effective, high cure rates, all the rest of it. But it requires local anesthesia and sometimes multiple doses spaced throughout a day. You go in generally in the morning, and they do everything they can to get the cancer out completely, which sometimes can involve stages where you might have 2 or 3 separate procedures all on that morning, possibly into the afternoon, to remove the cancer to the point where it doesn't show up on the microscopic sections of the most recently harvested tissue. The nice thing we have with this GentleCure system is we have an ultrasound wand where we can actually hold the wand up to the surface of the tumor and see the margins of it live, both before we start the course of treatment and then throughout the course of the treatment. We can see the tumor go away. The tumor shows up as black, and then as the radiation kills the cancer cells, healthy normal cells come in to repopulate the area where the cancer was, and that is one of the reasons you get a 99.7% cure rate with GentleCure. Painless. We've never had a case where the radiation dose takes longer than 1 minute to deliver. Of course, the patient has to come in, be positioned in the chair, have the equipment aligned, et cetera. So a visit is usually like 10 minutes. And patients are just very happy with their results, as are we. I went to lectures on dermatology, including Mohs surgery befores and afters, and it's a real pleasure to be able to take care of folks and not leave any scarring, and at the same time give them such a high rate of permanent cure. I admire the Mohs surgeons, how they're able to do rotational grafts and flaps and all these things. If you start talking about skin grafts, the hard thing is the cosmetic result. It can look a bit like a patchwork quilt. But those guys are talented. I have regretted more than once me not going through the Mohs training. I just chose to start practicing immediately after my residency. But I would really enjoy having more and more patients at least look at this option of no needle, no scarring, no surgery, no risk of infection, etc. It's been a great option, worked very well with our practice.
Our thanks to Dr. Forche. And finally, we turn to Adam Lefton, Chief Brand Officer of GentleCure, for a brief insight into the adoption of IG-SRT throughout the dermatological community.
But if you look at how slow adoption has been in areas of medicine where a better treatment option came along, and yet it took forever for patients to experience the benefit of those new treatment options, you can look at things like heart disease, ulcers, HIV, stroke care, mastectomies, right? All of those things were performed, treatment for all of those things were performed in ways that historically had been used forever, right? A better option came along, and yet it took years and sometimes decades for doctors to change. So you have to ask yourself, why did so many women have to undergo radical mastectomies in a day and age when the industry knew, right, that was not going to be of benefit to those patients? The question is, when is skin cancer treatment going to become the next example, right? Or are we going to learn from history and move faster this?
And Adam has given us a powerful insight to ponder. Thanks again to our sponsor, GentleCure from SkinCure Oncology. Until next week, thank you for watching and listening to The Distinctive Dermatologist. I'm Scott McCain.
Thanks for listening, and join us next time for The Distinctive Dermatologist with Scott McCain.